I'm here with Vicki Kahn, who just came in for a free discovery visit. I have yet to see her move her shoulder, but according to her, she's had frozen shoulder for how long?
Probably almost a year and a half.
And she's tried therapy, she's tried acupuncture, she's tried massage. What else have you tried?
They did cortisone shots and things at the orthopedic. They've done prednisone and nothing.
Okay, and her son is a patient here who just had surgery, and I said, well, why don't you send your mom in just to see if we can do anything, to see if we can help her. So here's the first time I get to see her shoulder move. So let's see, I just want you to raise it straight up in front of you and over your head as best you can.
I do better in front than I do.
To the side?
Yeah.
Okay, so there she's got maybe 115, 120 degrees. Good. Now what I want you to do, bring it down. 0 to 10 pain scale, bringing it down.
Probably about a 5.
Okay, now let's see, lift it straight out to the side and over your head as best you can. Thumb up.
That's as far as I can go.
Alright, so we're going to do a little bit of TMR on her, and I'll be right back. So the first exercise I have Vicki doing is just straight abduction on her good side. She's going up and down 25 times, nothing fancy. Just want to see what she can do. I want you to bring it up all the way up over your head and reach and then down. Perfect. How many have you done?
14.
Okay. So here's a patient with about a 2-year history of progressive frozen shoulder that has had cortisone injections, she's had physical therapy, she's had, what else did you say you had? Acupuncture. And she's actually looking into going, or she was looking online and found a miracle doctor up in Canada, and probably is not going to wind up going there, but hopefully she won't have to. So she just did 25 arm lifts. That's all I had her do so far, after I found that she's also limited in some of her twisting, which we'll do after. But let's see how high she can take that left arm and lift it up in the air now, compared to what it was. A little bit different, a little bit higher, and let it down. And now bring it straight out in front of you and over your head. That's a lot higher. And bring it down. And how is the pain coming down?
Not too terribly bad.
Compared to what it was? Slightly, moderately, or significantly better?
Slightly.
Slightly better. But go ahead and lift it up again, straight out in front of you and over your head, and look at the difference of that motion. And all we did was shoulder abduction. So, it's working. My rule in therapy is, if it's working, do it again. So let's have you do 25 more arm lifts, straight out to the side. All right, she's at 23, 24. This is her second set of 25 with her arm lifts. Okay, now, let's see what you can do with that left arm straight out to the side, just like you were. Thumb out, thumb up, and lift up. So she was below 90 degrees the first time.
Oh, look at that.
Bam! Oh, look at that.
There you go.
I can't believe I got this on video. Awesome. Put it down. And now remember how painful it was. Well, going up to the front, you had about 115 degrees, and it was about a 5 out of 10 pain coming down. Let's see what you have now, young lady. Woohoo! Yes! Let it down. How intense is that pain coming down?
It's not.
No pain?
No.
What are you thinking right now?
Where were you a year and a half ago?
Where were you a year and a half ago? I'm in the same place. All right. So, if it's worked twice in a row, what do you want to do?
Another time.
Another time. Go for it. 25 more. All right. We just went through some exercises. Actually, first, before we go ahead and talk about your history, go ahead and take that left arm straight out to the side. Bring it up over your head, if you can. How's that feel?
Not bad. I mean, it's probably like a 1.
When's the last time it was up this high?
I haven't had it up this high in a year and a half.
Awesome. And all we did was 3 sets of 25, lifting straight out to the side with the opposite arm.
Right.
Good. And bring it down. And now bring it straight out in front of you, if you can, for me. And up as high as you can. Now, how's that feel?
Good.
And let it down. All right, and you said you went to an orthopedic surgeon about a year and a half ago. He said it looked like frozen shoulder. He gave you an injection. And what have you been doing since that time? Tell me the progression of what's
He gave
coming.
me an injection because he put me in physical therapy.
Okay.
The physical therapy was doing nothing but making it worse. So
Okay.
I called him back, and I went back, and he did an MRI just to make sure that there was nothing. And he said there wasn't anything torn. He just saw tons of inflammation.
Okay.
So that's when he gave me the prednisone, and it was wonderful for my knees. It really did nothing for the shoulder.
Okay.
And he said, that I could come back you know, if I needed. He said that there was a surgery that he could do to repair it, but
Okay.
it was a last resort, that he didn't want to do that if I couldn't get relief any other way.
Okay.
So then I went to acupuncture. I did about 8 acupuncture sessions.
Okay.
Got basically no relief from that. Then I went to a massage therapist
Okay.
who deals with this type of thing all the time. He was sure that he could get it loose, but he never did.
Okay. Awesome. And so, thanks to your son having to have his second labrum repaired,
Yeah, here I am.
here you are. And we're glad you're here. One more time, lift that arm straight out to the side and over your head as best you can. And you had that at about 75 or 80 degrees the first time you did it. And with the how much pain was it when you lifted it the first time here?
A lot of pain. Now it's just kind of, it's just tight. I can feel it, but
Okay,
it's
and
not
you've been
super
here for a
painful.
total of maybe 5 minutes doing these things? Awesome. Put that arm down. Now arm straight out in front of you and over your head. And you were at about 115 degrees. You're nearly full motion there, and you had a 5 out of 10 pain coming down the first time. How's it feel now?
I don't have any pain now.
All right, so if I told you that this technique was called total motion release, what would you think about total motion release?
I think it works.
I think it works. And I'm probably going to send this to your doctor.
Okay.
I'm going to make a video, send it over to Dr. C,
Yeah.
so that I won't say his name, so that and just see what he has to say.
Okay.
All right? Thank you very much for doing this for me. All right, I thought I was going to be done, but we just did some overhead bouncing motions with her good arm, and now check out her abduction. Look at that, she even knows what abduction is now. And so that soreness that went to tightness after just the lifts has now gone, and it's just feels almost normal.
Yep.
Okay, and now bring it straight out in front of you and over your head. And how's that feel?
That's looser.
Looser and no
too,
pain
yeah.
coming down.
Right.
So overall, with just the motions going up, if you were to grade on a 100% scale, you walked in at a 0 with your limited motion and 100% is totally normal. How much better are you feeling?
Probably 95.
95% better, and you've been here a whole 20 minutes. Awesome. After a year and a half.
Yep.
Thank you for doing this again for me, and hopefully, you know what, we're done for the day with the video, so thank you.